Okay, welcome everyone to what I think is really a special podcast here with my good friend, Dr. Danny Alvarez. My name is Daniel Sanchez, and I'm a health and fitness coach. And my background is exercise science and sports nutrition, and Danny's background is physical therapy. So we're going to have a really interesting talk here about shoulder rehabilitation, especially with chronic pain, looking into how to prevent as well these problems. And we're going to use the book Treat Your Own Shoulder by the famous physical therapist Robin McKenzie to guide our discussion. It's a really interesting book. And while we were looking at it in past weeks, we thought it would be a great idea to record our discussion around this book, and I'm really excited to do that. And Danny, you may add to your introduction or go ahead and
This
jump
is
in.
exciting. The treatment of the shoulder is not necessarily, what McKenzie is famous for, but outside of the back, like he's really shown kind of very simple yet nuanced ways that anybody can really be autonomous in the treatment of their own symptoms. And I think it'll be super sweet. Like they not like they might not be applicable to everybody, but he gives very clear guidelines to who those people are not and who should like kind of seek out further care. So hopefully this will maybe like influence you to try and treat your own conditions if that is something you have. And but yeah, doctor of physical therapy, I look forward to sharing everything we know together.
Yeah, and also I had to, you'll see after in the editing, I had to blur a lot of the book out. That's just to respect their copyright, but I'll also leave, you'll see that I left key quotes open because that would be in line with fair use and commentary that's allowed publicly. So here we go. And I thought that Dr. McKenzie's intro was very good. The writing of these books is very, I think, very well done. And one of the things that Dr. McKenzie talks about, and it reminded me of the research I had learned about the lower back, was imaging isn't going to, that imaging has some salient limits. So you can get whatever MRI or whatever it may be, but that's not necessarily going to help you pinpoint the cause of your pain or provide a solution. So here, this quote in particular, in many cases, even the use of X-rays and MRI scans do not give an exact picture of the site or severity of the injury. So what are your thoughts on that?
Yeah, so imaging is a double-edged sword. It oftentimes helps people kind of pinpoint the location of the injury, but oftentimes it gets people a little hyper-focused on their injury, maybe perceiving it to be permanent. It's particularly malicious for those who've been experiencing pain for over 6 months. I've noticed that just about everybody, not necessarily everybody, but most people that I've seen who've had pain for longer than 6 months and see imaging thereafter only get worse from that. It's almost better to just not see it, to not worry about it, and focus on more so the feelings inside, what your body is doing, because the body is really powerful, and being able to take advantage of the natural healing processes is what's going to promote the best healing.
And that's something I think of, is that our bodies, even if you're older, our bodies do want to heal, right? If we're willing to help them along. I remember,
Absolutely.
so arthritis is mentioned in these books as well. And you made a good point to me the other day, is that a joint can be pretty far gone, but if with the proper movement, it can be rehabilitated quite well, even if the cartilage is quite deteriorated or the joint itself is quite deteriorated. So what's really possible there for people if perhaps they're attributing their shoulder problem to arthritis or a worn out joint?
Absolutely. So many times. I mean, it must be at least 4 or 5 times every day.
Oh,
Someone comes up to me and says that their joint is bone on bone and that their orthopedic surgeon told them that it is just a matter of time before they require some sort of replacement or surgical intervention. But it's not permanent. Like you said, it is possible to grow back cartilage. It's not like the muscle or the bone where those structures in our bodies have a very rich vascular supply where, very quickly they'll get nutrients from our blood and grow back and heal, say in 4 to 6 weeks, or maybe even less. But with cartilage, only the outer third has a vascular supply. And, the older we get, that third kind of shrinks. Maybe it's a fourth or a fifth. But the cartilage still does get nutrients throughout our life. And the way it does that is through the synovial fluid. The only way, though, that the synovial fluid can transmit the nutrients from inside of it to the cartilage itself is through forces, kind of like you mentioned. So the best way is plyometrics, jumping and skipping. However, a lot of people who've experienced pain for a while, or maybe, over the hill or things like that, aren't really capable of participating in those activities just yet. But even things like increasing the maximum force contraction between the quads and the hamstrings, that's too is going to push the joint down together and apply pressure within the synovial fluid so that there's a positive pressure gradient into the tissues of the cartilage. And that way, that positive pressure gradient pushing the fluid in there is going to give it the nutrients it requires to grow, heal, and become healthy. It'll be moving again. It will prevent, fusion of the joint. Uh, One also comment, now that the idea of fusion comes to mind, is if they're telling you that it is bone on bone, it probably is not, unless you go to bed that night and the next morning you wake up and it's fused. Like, there's probably some cartilage left preventing it from fusing if there's no fusing going on the following morning. All it takes is one night of being still, bone being on bone, for it to fuse completely.
that's a good point. I've also heard that around scar tissue, people would think. I remember us talking about that in class with one of our professors. Was scar tissue also? It's not just dead fiber there. It still has some life to it, and it can, to some extent, if I'm understanding correctly, that can improve and get better as well.
Absolutely. There's a cool concept that Dr. Hogue taught us,
Yeah.
where there's like these tiny myofibrils, I think he called them, inside of the fascia and our scar tissue, and they contract, or they relax and contract to kind of help tissues move across our body. And that's kind of like how scars widen or close up through those myofibrils. Um, but it shows how much life is within even what we consider dead tissues.
Yeah, absolutely. And the intros are usually powerful. So here you're seeing that, and this is one of the catches with chronic pain, is it can be reassuring. And I believe that if I go to a clinician, I would hope that they do would let me know, is that most pain, like back pain, will go away by itself. But one of the issues is that it can also come back if you don't change your habits and what you're doing. And that's what, similarly, what he's touching on here is the pain returns later to affect you once again. So how, what are your thoughts on that? That is that perhaps something that maybe tricks people, is that don't, yes, it's nice that the body will, that these things are what I believe is called self-limiting, but also just because it's self-limited, you still want to do your detective work, still want to try to rehab your habits and strengthen the area, because it can also, just as it went away by itself, it could also come back again.
Yeah, if you got hurt, there was probably a reason for it. Like,
Yeah.
I don't think it's possible to experience some sort of ailment without any initiating factor. You know, whether it be physical or psychological or anywhere in between. But to rest, relax, recognize, complete what you do, and heal, but then go back to what you're doing exactly the same is almost guaranteeing the the injury to return. So doing that detective work, investigating kind of why you might be experiencing what you're experiencing happened, and trying to play around, have fun with resolving it is typically the best way and the natural, like humanistic way of resolving injuries.
Excellent.
I think this is a good page to kind of show how our modern society, what we're doing all the time, like leads to shoulder injury. Because if you think about the prehistoric person, where we're always kind of upright, walking, climbing, pulling, and stuff. But now in the modern human, we're seated, slouched, and pushing overhead, pushing up above, holding up above. So we evolved to primarily utilize pulling. However, in modern days, we're primarily pushing. And that imbalance between our musculature, in my opinion, you know, from what I've heard from a few therapists, particularly Dr. Andy Cook in Adapt Performance in North Carolina. Um, that's why a lot of people have shoulder injuries. And oftentimes the best prevention is building that, you know, bigger pull to push ratio.
That was great to talk about the other day, because you were saying it's about a 3 to 1. So say, for example, for listeners, if I can do 10 pounds on a chest press, I'm sorry, if I could do 30 pounds 10 times on a dumbbell chest press, Danny was explaining to me that I should be able to do that 2 or 3 times as much with a horizontal row, or with rowing with those same 30-pound bells. But for me, my chest pressing tends to be stronger than my pulling. So
That's right.
my par for the course for me. But
Me too. You know, I'm a modern human, and growing up, I always just did push-ups. Like pull-ups
Mhm.
wasn't really accessible to me. I didn't have a bar or like anything to kind of climb upon when I was, you know, like a young adult. So I did a lot of push-ups, and I didn't have particularly shoulder pain. Maybe aches and clicks and pops and things were here and present. I might have like trigger points or whatever in the back, but nothing crazy. However, now that I recognize this importance, I've made a bigger effort, even hanging and pulling on door frames, like building that strength to just go into a door frame and just give a couple of pull-ups, or do like a what is it called, like a front lever or anything like that, just to really kind of strengthen that pull. I'll try and take advantage in any moment.
Awesome.
So this is actually a position that I've learned a lot of people with neck and shoulder pain choose, because it kind of puts all of this musculature on slack when you're sleeping.
Mhm. And it's interesting because what they're saying is that they do that to relieve their pain, but the book is saying here that that also is putting a static load on the shoulder, so that's not necessarily. And the book does go on later to explain a proper sleeping posture. And a theme you'll see in the McKenzie books is one, they go through ways to progressively place forces on the tissues to start rehabilitating them, and how to monitor where those exercises are benefiting you, making things worse, and whether you should seek further medical care. But also, they go through the hygiene for the joint, how to, from your sleeping position to the way you work throughout the day. So, for example, it is recommended in the book that, say I am it could be any type of laborer, but you don't want to be reaching overhead. So if you can get a small step ladder and raise yourself to a higher position so that you're reaching across rather than up. And it was interesting because you and I were talking about the other day is that it might seem, and actually this morning I was at a cafe, and it is actually quite an interesting anecdote because I was talking to him, asking him, "What do you do? Paint or you're a contractor?" He said he does sheetrock, the walls, and he said exactly that. He said my left shoulder is all, with strong language, messed up, and it's tough. You know, he had a good he had that sense of humor about it, but that's exactly what we were talking about. Is he was saying, "Oh, but they push for production. You got to get stuff done," and I understand that, but it's perhaps hard to get people perhaps motivated to make the trade-off that, okay, maybe you'll be a little slower when you take these steps to take care of your shoulder, but think about the time you'll have in your career over the years, and think about the time you might lose or the money you might have to spend. I joked with them a little bit. I said, well, you don't want them to make the money and then have to go spend it at the doctor's office for your shoulder. So it is one of the difficult parts is it might not even be that hard to get people to do the exercises, but it may be difficult to get people to follow through on the hygiene for the joint throughout their day and to be disciplined about that as well.
Absolutely. That's the hardest thing. Changing something they've been doing for so long. Let's say you've been working that way for 20 years. Sure, it might take about 21 days to make a new habit, but completing 21 days is the real challenge.
Yes. And I also wanted to talk about you frame it a little bit different than I had been framing it, but you talk about the four pieces that go into health. And so you have what you would say is love, if I understand correctly. That's our community. Perhaps it's even the way we feel towards ourselves, our attitude, our rest, nutrition, and movement. Did I get those four right?
Yes, I do like to use the word food instead of
Oh, food.
nutrition. Yeah.
Yes. Food. And that's one thing area that maybe these books are a little limited in. If I recall correctly, I haven't read yet in the McKenzie books I've seen that being covered, but it is important also to, and this may be a, a, a point where it's hard to get buy-in, but also your nutrition is going to affect how how resilient you are to injuries, how quickly you can recover. what you're eating is what these tissues are going to be made of. Again, it also can help better modulate your immune system. We know that eating too much of the wrong things can suppress your immune system, and having a more balanced diet can allow it to function normally. And to function normally, you would say, well, what's the big deal about that? But often, because of the way people nourish themselves, the food they take in, they're so often below normal with their immune system that these things don't heal well.
Yeah, absolutely. You know, how do you expect yourself to heal if you don't give yourself the proper building blocks to do that? And going back to the immune system, healing in general is initiated and mediated by the immune system. So if that's dysfunctional, then you'll never truly heal properly.
Yes. And I know we haven't made too much of a dent in the book yet, but the book does a good job of letting you know whether it's suitable for you. And I thought, well, maybe this is where you can jump in, Danny, is instead of me going through the book, how could a person know if a book like this is suitable for them, and when is it better to make sure you go see a doctor?
Yeah, so this is super important because, you know, you might be having shoulder pain and trying to fix it and treat it and stuff like that. And you keep doing these exercises and it might get better because they're relaxing or whatever. But then, you know, it comes back, you know, you're in a stressful environment, you're back at work and it comes back. And then you do the exercises, you kind of relax, it feels better. However, it doesn't resolve. And soon to find out there's nothing wrong with your shoulder. You're actually just having angina and you're like just about to have a heart attack. The next thing you know, you go through a cardiac arrest, and like that should have been something that could have been taken care of by, you know, a primary care um, practitioner. So, you know, doctor of physical therapies are pushing currently to become primary care practitioners, not just the primary care physician, to help like reduce the flow of care and the cost of care. Oftentimes, I see people who they saw their PCP. Their PCP sent them to the neurologist. It took 6 months to see their neurologist. Then the neurologist said, "Oh, you need an MRI." They get the results from the MRI, and then they come back to the neurologist and say, "Oh, it's fine. You just got to go." It's not. Oh, it's fine. You know. Oh, this is what's going on, and this is actually best rehabilitated through physical therapy. And then you go and see a physical therapist. And then it's like, okay, a year later, they've been dealing with their issues and they're finally seeing a physical therapist when, you know, they could have gone and done that the first time. Um, and if there was something outside of the scope of physical therapy, they could have sent them immediately to the neurologist themselves as opposed to seeing the PCP and blah, 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 blah. But the main notes here is that they're trying to make sure that it's not an infection going on, it's not cancer going on, it's not an issue with the central nervous system or the spinal cord going on, and or the neck. So really, if you see that you have a history of cancer, tumor, I mean, in physical therapy, we look for 5 things specifically. Um, like if they've had unexplained weight loss, if they've had a history of cancer, they're over a certain age, I believe it's 50 or 55, and if they're not sleeping well at night, or if their pain is like going through the night. But uh, you know, just the history of cancer, like he's trying to keep it very specific and clear, not going into the details, essentially more sensitizing like the experience of what someone is capable of following through with this book. So it does
Yes.
make it a smaller spectrum of people who is applicable to benefiting from this book. However, if you were to open it up to people with neck and upper back issues, it would be more so, you know, a textbook as opposed to, you know, a quick like treat yourself type of read. Because the
Yes.
neck and back itself is complicated.
Yes, and so the book shows you how to do that. Is that to uh, to single out neck pain. So if you have neck pain, you'd have to consult the Neck Book by McKenzie. But basically, this book will help you if you've had, and there's a checklist, and these are the exercises to single out the neck pain. And so it is pretty clear, or it's very clear eventually. There's a 10-question checklist here. And if you answer yes to all 10 questions, you're an ideal candidate. If you answer yes to 5 or more, you're a good candidate. And yes to 4 or fewer, then they're saying you should consult a medical professional. But as far as treating your own shoulder pain goes, McKenzie is talking about pain in the upper arm area. So nothing on your back area, your shoulder blade or scapula, and nothing going into the neck. But
Or the
it's
elbow and wrist.
right, correct. Nothing below the elbow, no tingling or
So,
numbness. And go ahead, Dan.
yeah, sorry to cut you off, but if you are interested in trying to treat yourself, if you feel like it's related to the neck, according to these tests and things, there is kind of like a quick philosophy that you could start out with. You know, it may or may not help you completely, but the idea is if you explore movements, you know, you do different things, and those movements that bring the pain more centrally are things that you would like to do, and those movements that bring it away from you or down the arm are things that you don't want to do and you want to stay away from. And essentially, those movements that do bring it in and even feel better are the movements that you want to add to your regular exercise program.
Okay. Dr. McKenzie makes this point is similar to Stuart McGill's analogy of hitting your thumb with a hammer. Is how is it that the tissues become traumatized? He uses the analogy of bending your finger back. Now, say you bend your finger back all the way to the point of causing pain. You could do that. Well, if you let off, the pain will subside quite quickly and shouldn't come back, and your finger should be fine. But imagine if you keep bending that finger back, put it in pain, and then hold it there for a while. And then you do that repeatedly throughout the day. And over time, you're going to have a finger that where the pain continues and could become more permanent. And so that's the little analogy to help you understand what we're doing to the structures that are less visible to us, perhaps in our lower back or in our shoulder. It's interesting how this works, is that if you want to heal these damaged tissues, is that you actually have to start. So it's interesting that the wrong forces can hurt you and cause pain, but it's not just stopping the wrong forces that heals you. You have to apply the right forces. So there's forces that heal that are actually good for us, and then there's forces that hurt us. So I think that's a beautiful part of the whole healing and rehabilitative process. Postural neglect. So just plain old slouching can lead to shoulder pain. And he also explains later on that if you slouch, it's harder to lift your shoulder overhead. And this is what he's demonstrating here with these photos. And this is something that perhaps you could, what are some strategies for people to effectively correct their posture throughout the day? For example, I have right now a poor man's lumbar support. It's a rolled up bathroom towel, but I just have
Nice.
this in my lumbar spine here.
Yeah.
I'm trying to rehab my back from 80% to 100%. But what are some things that could help people move in the right direction?
Yeah, posture is hard because all their lives, they've been told, oh, correct your posture from their teachers, from their mothers, their fathers, whoever, just constantly telling them to correct their posture and almost like makes people not want to. So um, when a physical therapist becomes that posture police, it almost like recoils back. But I've learned that when you can make someone say it themselves as opposed to saying it to them, they become more avid or autonomous in their ability to do that. So, for instance, that test that we saw where someone was trying to reach their arm overhead, you notice that they have pretty terrible postures like, hey, try and reach overhead, and then they do it. And they're they could barely reach that high. And then you like correct their posture for them. And now you say, hey, can you go ahead and try it now? And then they reach much higher. And I was like, which one did you feel like you could reach higher? And they'll be like, oh, this one. Which one felt better and more functional? It felt healthier. Oh, this one, yeah. And it's like, okay, what could you do throughout the day to maybe help your shoulder feel a little bit better? Maybe if I just stand upright, I'll feel a little bit better. Maybe you will. Let's try it. See if it works. And then next thing you know, they are a little more mindful themselves. But going in right away and saying, "Hey, your shoulder looks like trash. You need to sit upright more often." Like it's gonna make them slouch deeper, for the most part.
Yes, it's interesting where the rubber meets the road. That it's one thing to know your stuff, but if you can get people motivated, if you get people getting the buy-in is that that I that probably just takes experience, takes time.
Yeah, that's the hardest, but probably the most valuable skill. Like in terms of specific things, if I were to say any one tip to help people correct their posture, it would be to stand without leaning on stuff. Um, because it's really the sitting that kind of facilitates that. Even when you sit with a slouch posture, it feels pretty good. When you stand with a slouch posture, you realize that it doesn't feel that good after a while, and your body will naturally correct itself subconsciously because that's what will feel better and more ergonomic and more efficient. So if you can get people into a standing desk or some sort of like standing opportunity without putting their hips on it, like I notice when I wash the dishes or something, I'll put my hips onto the counter to like rest so that I don't have to use so much like of my lower extremity musculature. But I take my hips away from the sink while I'm washing the dishes, and sure, I feel my hips working a little bit more. Um, and my back working a little bit more because I have that torque applied from reaching forward and washing. But it does feel stronger, it does feel more stable. And then after the fact, I find myself standing more upright for longer periods of time more comfortably.
One of the things that McKenzie does recommend is breaking things up. If you've been sitting a while, stand up. If you've been overhead reach, if you had to overhead reach, well, take a movement break, a stretch break, and they do explain how to do that. But basically, anything that's prolonged too much can become a bad force towards the body. So, variety, the body seems to like variety.
Yeah, that variety is a good point because he even says that standing for too long will make you lose your posture. Where I suggest more prolonged standing, maybe as much as possible might not be the answer. Just diversifying that position and posture is what's ideal.
Yeah. And here they go into the sleeping posture that we touched on before. And so for anyone wanting to deep dive a little bit more into the details, the book's an easy read, but going through standing, sitting, breaking up your routine, how to sleep. And so he talks about environmental factors, improving your daily routine. So here he has someone about the
Before we
fall.
move forward, sorry
Yeah,
to
yeah,
cut you off, but before we move forward, I would like to talk about sleep hygiene.
yeah.
Um, it is
I enjoy
it is so
sleep.
common for all of us to sleep on our side, right? We sleep on soft beds, so we sink very nicely into it. But that side sleeping does really prevent a lot of blood flow and prevent optimum posture in that shoulder. So maybe switching sides every other night could be ideal if you can sleep on your back, but I hear that sleeping on your back is the best. And people find that the best way to sleep on your back is actually to sleep on a firmer surface. When you have a soft surface, when you sleep on your back, that's when you have kind of like back aches because you kind of sink into it, kind of like you would if you were to sleep on a hammock, um, creating that banana shape on our body as opposed to like the natural straight posture that we would like to have. So, yeah.
It's not mentioned in this book, but if people are struggling with or want more tips on proper bedding and sleep, in the low back book, McKenzie covers this. And there's also just something as simple as folding or rolling up a towel and tying it around your waist, not too tight, to also help maintain your spine while you're sleeping. But also, yes, as you were saying, if the surface is just too soft, that can cause problems. And that also, this is just a working theory of mine, but I think that's why, especially as you get older, why daily movement is so important, because you spend 8 hours immobile. And I think that 8 hours, for all the good it does as we get older, that the negative part of it, our bodies seizing up a bit, can go into the next day more and more as we age. So as my thinking process is that we have to, even the little bit of movement we do each day, going for a walk or some stretches, it's just part of it is just undoing how immobile that we were immobile for 8 hours by
Yeah,
necessity
it's a
of our
long time to be
species.
still.
Yeah, it's a long time to just be there doing nothing. And it didn't
Unless you're a
phase us.
sleepwalker.
And it doesn't phase us when we're young, but when we're older, you can be, your body can, my understanding is you're getting bound more and more bound up by it with each day. And so this was some of the adjustments we were talking about, is getting a small step ladder so that you're reaching horizontally instead of vertically. Better desk posture, same here. Drilling into an invisible wall,
Yeah.
drilling the invisible wall across from you, not reaching up.
Yeah, you
And
brought up a interesting idea last time when we talked about this, how someone might say, "Oh, but now I got to spend the extra time getting a ladder and carrying a ladder around and bringing it up."
yes,
But if you really think about it, the investment will pay itself off hundreds of times over by just bringing a ladder, you know?
and that's maybe how you can get people's ears, is if they're a business person or it's their profession, if you can point out the financial implication. Hey, you lose a little bit of time, but think about it. How much, especially if they end up in an office with you, it's like you're losing time right now. You're not working. You're here paying for medical care. You you're in pain, so you're obviously not as productive as you could be because you're trying to work through pain. So there's probably a lot of ways you could, and someone could become incentivized if these things are happening in their professional work. But I won't make too big of a tangent here. But sometimes too, if it's maybe someone has a pending settlement or car accident or something, maybe they're not motivated to fix the pain because they they have other reasons financially for not fixing those things. So it is important to 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 circle back here is the person motivated? Are you motivated to work on this? Because I believe it is true is if of course if you don't want to get better, no one can want it for you. No one
Yeah,
cares about your problem as much as you do. It's your shoulder. As much as there's great people out there like yourself, nobody can care as much as you could care for your own
yeah,
joint or limb or injury.
yeah. That conversation is hard. Like people, not wanting to get better because for the most part, in my experience, even people in those situations, like subconsciously, there might be something within them who have appreciated the sick role, if you will, and try to keep that. But consciously, like they truly believe that they want to get better and they're trying to do their best to get better. But there is this weird disconnect between the conscious and the subconscious and the persistence of like rehabilitation because for a variety of disorders, not necessarily physical pain like back pain or shoulder pain from a car crash, but like even a stroke or some other thing like functional neurological disorder too. Uh, a lot of these things, the subconscious is trying to be as nutritiously efficient as possible. If we don't have to move this part of our body and spend calories using it, like we are winning as a like species and creature. And when it recognizes that we don't have to work to survive and we don't have to like move this arm to survive, like our subconscious is going to try and keep that. And it's super abstract, this type of like research and how to treat it and how to deal with it and how to work with it and stuff like that because the philosophy kind of leads us to kind of cruel treatment methods and like we're not really capable to going through that because it would involve like making the subconscious believe that it is not capable of surviving without the actual usage and rehabilitation of that component of our bodies, whether it be neurological or physical. So it's tough. It's really tough, those types of conversations.
Yes, but for movement professionals out there, if you have that capacity to focus people, and I believe motivation and motive having to do with motion, like an automotive, you can get people focused, and then I think their motivation will follow. You know, be very successful. People are going to be raving about you to their friends. And here is a stretch just to do throughout the day. So this is one of the maintenance stretches that people can do. These are tips on how to manage awkward positions, prolonged sitting, standing. Here is what is photo 60, I believe. This is for yes, it's a lumbar support. And so I don't have this. I just use a rolled up towel at the moment. I'll spring for the $50 lumbar support soon enough. Lying in sleeping position. Oh, and dealing with frozen shoulders. So I know that even in personal training setting, fitness setting, people will come to you with a frozen shoulder. You found to have a friend with a frozen shoulder nowadays. That's discussed in this book and also can be, there is hope for that.
I do want to
The-
make one comment on the movements that he suggests. Uh, like if your issue is caused because of repeated overhead movements, like essentially what he's suggesting with that, initial stretch that we saw was to go the opposite way. So the stretch is to pull the hands behind the back,
Mhm.
which is something you probably don't do. So you go and you're always here pushing forward. Okay, let's do the opposite. See how that feels. Oh, it's kind of relieving. Excellent. Like, keep doing it.
Okay, cool. And finally, getting to the McKenzie method itself. And they do, and again, for me, I find this book very clear. And so here you'll have, okay, when you are doing the McKenzie method, treating yourself, when you're treating, okay, to rewind a little bit, you're not treating something that's a fresh injury or something accompanied by uh, even a vague illness or weight loss. You just know it's been years. You've had this nagging shoulder pain. You know it's about in your shoulder area. It doesn't go past the elbow or into your shoulder blade. You're generally well besides that. Okay, so now you're going to look into the McKenzie method. You went through those 10 questions. You've gone through the book carefully, and so now you're going to look at the exercises and they explain, okay, how do you know they're helping? Well, if your pain goes away, the pain changes, or the pain moves. And they explain more. They dive into explaining what they mean by these. And again, when it says please read carefully, I recommend you do that.
Yeah, moving pain is, a little more complicated of a topic because it involves typically one of two things, referred pain or radiating pain. The referred pain is like the patch of tissue or skin where you feel the pain comes to the same, ganglion in the spinal cord as the nerve that goes to the injured tissue. And your body can't really differentiate the two. The radiating pain is you're along the same nerve and, it's going from one place along the nerve to a different place along that same nerve. So differentiating the two is sometimes hard, but regardless, you do like to keep the philosophy if it's coming closer or like more attuned to a specific point and like a smaller scope of pain area, then you're doing a better movement. You know, and another thing too is if the pain is relieving when doing the movement, it's a good
Okay.
activity to do.
So the chapter 4 prefaces the method, and similar to what Danny was saying. And then finally, chapter 5 is actually getting into the exercises. So
The
it's,
program A.
yeah. And usually in the McKenzie program, from what I've seen, is the first exercise is something that helps you manage pain. So with the low back, you're simply lying in on your stomach, totally flat, laying your lower back sag down into the floor. Here you would start with a pendular exercise, which is making circles with the affected arm. And they offer good advice in that try these things first with the unaffected or pain-free arm. Don't practice. Try not to practice first on the arm that's jacked up. And so here it's illustrated, or I'm sorry, photographed. And
So
that,
I want
mhm,
to go back to that last exercise really quickly
yeah,
because this is one of the hardest exercises that I have to teach people.
okay, excellent. So yeah, please.
Yeah. Oftentimes people will do this and they're just kind of like swinging their arm around with the arms musculature, but the idea is to kind of help release and relax a lot of the musculature so that there's not so much tension amongst them. So the movement is not coming from the shoulder. The movement is actually rooted in your hips. So you swing the arm by leaning the body forward and back to make the swing happen in the arm. It's not actively swinging the arm with the shoulder musculature. That takes a lot of practice for people to do, especially those who are injured because their muscles are so tense and tight. But you practice that relaxation and then just gentle rocking, letting kind of the momentum of the rocking of the body help swing it. So uh, I
And
definitely suggest practicing a lot.
and thank you for, so that just illustrates perfectly why, if you are unsure, and again, I would say, well, first let me ask a quick question. If you're in any doubt whether you need a doctor or not, go to the doctor. Would you agree with that, or am I begging the question there?
No, it's a pretty good
Like a
train of thought.
rule of thumb, like,
Yeah.
and second,
If you,
yeah, and then
sorry, but
second,
yeah, if you feel like it, yeah, you should probably do it.
yeah, and then secondly, here, as that's why someone trained in this can be very helpful, because if you do read the book, it doesn't say to use your hips, and it makes all the sense in the world now what you just explained, but it does say just slowly swing your arm backwards and forwards in an arc that is pain-free, but maybe like you're not getting much benefit from it because you're maybe using too much of the shoulder muscle and you're not actually allowing, like you're saying, those structures to release and relax and relieve some, desensitize and relieve some of that pain.
Another comment with this exercise is please use a stable surface, not a rolly chair, as depicted in the photos.
Yeah, this um yeah, the chair rotates, it rolls. It's completely unstable. Oh my goodness.
Yeah, it seems like a little bit of a mess waiting to happen.
And here next is a shoulder extension, and you'll see that there's progressions. You're starting with just applying pressure with your pain-free or unaffected arm, and then they'll use a dowel. So here, using a dowel, once again, uh, uh, shall we say, perhaps if you have a death wish, using a chair that rolls and moves and rotates.
Yeah.
So use a
Yeah,
stable
use a
surface.
stable chair and then like walk yourself forward.
Yes. Now here she's squatting while using the unstable chair. And then this exercise 3 is one. There's a few exercises that are maintenance exercises. So one is internal rotation in standing, and then the other is, while you're standing, is elevating your arm overhead, a wall, basically a wall slide with a towel. And jump in as you see uh, fit. These exercises, they're done in the pain-free range. So as Danny was saying, you kind of just kiss the pain if you get to that point of pain and just barely touch it, but you're not trying to elicit pain with these exercises. As you were saying before, if you're seeing that, you should have the pain change in a good direction where it's decreasing or getting or centralizing. Did I understand that right?
Yeah, absolutely. That's right. Kiss the pain, don't hug it. Like, don't go into the pain, go up to it.
Yeah. So here's the first elevation. is in lying. And then this is the shoulder elevation and standing is another maintenance exercise where you're sliding a towel up the wall. And then finally, there's shoulder strengthening. So these are the 6 exercises. So what's also great about the McKenzie method is that he's able to keep things pretty succinct. You have about a handful of exercises, guidelines on where to know you're moving in the wrong or right direction, how to progress them. They're not too time intensive. Basically, you're doing increments of about 5 to 10 minutes snacks of exercise every 2 hours, and try and get to 6 to 8 sessions of. So basically, you'll be exercising an hour a day, but well worth the goal because you're going to desensitize and hopefully diminish a lot of this pain. And also it's an hour, but it's broken up throughout the day. So just find time to get these little movement breaks and these little rehab breaks.
Yeah,
And
I oftentimes find people unwilling to do more than 4 or 5. So I usually suggest 3 times per day, like right before a meal. And if they don't eat 3 times a day, then just like when they wake up, the sun is highest, and then before they go to bed. Because as much as I would love for people to do an activity, 8 to 10 times per day, I struggle to get people to do it 2 or 3 times per week. So don't feel bad if you cut that down for yourself. However, if you are, one of the more motivated type and you do squeeze in like 5 minutes every hour of your waking day, excellent. Like you will definitely progress tremendously. And that philosophy is most important for those who have persisting pain. That is pain longer than 6 months typically. So earlier, Daniel used the word chronic pain. I do prefer like persisting pain as a term because chronic tends to have like a bit of a negative connotation, kind of scare people just a little bit. Persisting pain is more like personable, if you will, and digestible to a person in a regular kind manner. Typically nowadays when people speak of chronic too, they're using like dank weed, if you will, or something of the such. So don't want to convince anybody like, oh, get that chronic going. No. It's
right,
like a little persistent.
persistent pain.
Yeah.
I like that, using words as effectively as you can. And so this is again, I like it that offers hope is when to apply the exercises. When you are in significant pain, wow, that offers me hope. I don't have to pop a pill. And note that there are side effects to pain killers, whether it be an NSAID or opioids. So if you can do, in my perspective as someone who would apply these to myself, is if you can give me something where I can relieve the pain myself in a way that's practical enough, as opposed to having to pop a pill, for me that's a good trade. I don't know about other people, but I don't want to have to deal with the side effects of drugs, especially strong ones, especially perhaps on my gastrointestinal system, whether it's affecting the mobility or motility of my GI, or the or even with the NSAIDs, I believe it would just be affecting how the GI forms. Is that correct? It also has an
Yeah.
effect.
Yeah, they typically cause like stomach ulcers and things with
Okay.
prolonged usage. That's the main concern that a lot of people have, but they have so many other side effects as well. But um, I too think that it's a great opportunity to utilize something other than medicines. And most people I talk to, if not everybody, will state that they don't want to have to take medicines, that they wish there was an alternative. Um, the only thing is that they feel that they need it. Oftentimes is like, oh, I want to do something else, but I just need it. Like they have this strong feeling of need in their mind. But when you can supplement that that pill with something like a pendulum exercise, it might build a lot of hope outside of their condition and, autonomy into their growth, following what it is, what they, at least superficially want, what they say that they want.
1 through 5. And the thing is as long as you're using your unaffected arm as the standard, so if you can get to exercises 1 through 5 with the same mobility and range as your unaffected arm, but you still have some pain, that's where they introduce some strengthening. So just by pushing sideways against a wall.
Yeah, I like armchair isometrics. So that's where you just kind of sit in an armchair and you push it in different ways. So you push your elbow out, you push your wrist out, you push your elbow in, push your wrist in, and then put the elbow in front of the armrest and bring it back. Those are just a nice, convenient way to hit the majority of directions in isometrics. Typically, I dose it with 10-second holds 10 times. I don't do that one more than once a day, though. Like I tell people, try to have rest for those types of exercises.
Is at least related to nutrition, because you'll see it often in diabetics. And one thing that really interests me is I was intrigued by the research and the physiology of vitamin C, because my understanding is that glucose, the digested product of eating sugars or starches or carbohydrate, it competes with vitamin C for entry into cells. But vitamin C is very important for the formation of our connective tissues. And for example, in scurvy, that's how you would die, is by hemorrhaging. You're vitamin C deficient, and eventually your connective tissues can't hold together and break down, and the person hemorrhages. And so in frozen shoulder, it's often present in diabetics who have trouble dealing with carbohydrate digestion. And then it seems like perhaps their shoulder is the place where it shows up, this connective tissue problem. So for me, it's just an interesting lead in research. I'm not saying that that's how it works, but I would say it's another reason to make sure your food is right, or balanced, because this very well may be not just from posture or overuse, but because you might have actually eaten yourself into uh, your
Yeah, that'd be
tissues into a
incredible
poor state.
research. Yeah, that'd be incredible research to go into if we could resolve frozen shoulder more quickly without any exercise or anything like that, but literally reduce carbohydrates and increase vitamin C consumption.
Well, I think the point would be is if the body is balanced. So I respect like the rehabilitation. So for the audience, this is a good point. Is like if you're a personal trainer or in fitness, you look at movements. You don't look at individual joints. That's what the medical professionals do. The physical therapist can deep dive in what's happening at the joint, perhaps what's causing the injury. And then the fitness professional looks again at integrating that joint and how those joints work together and how the person moves. And similarly, like on my end, I don't know. I would never fix any specific. The fitness professionals or health professionals, they don't fix anything specific. That's up to the dietitian. But my understanding is, okay, if we nourish the body right, balance the body, okay, let's see what happens. Do some of these things get better? Is it it's just the body wants to go. My understanding is the body wants to heal. It wants to go in the right direction. We just have to help it along, and these things could probably improve. Or if you do have a frozen shoulder and you start eating right and balancing yourself, I would assume it's going to help you. Uh, uh, if it doesn't help you, at least you're healthier. The rest of your body is better off anyway, and it could help you. Even
Yeah,
just
when we
being
talked about
hydrated.
the exactly when we talked about the four pillars, it's not like any one part is more important than the other. Like
Yeah,
the movement is 25% of the picture. You know, the nutrition, or excuse me, the food is 25% of the picture. Like you can't prioritize one over the other for any singular injury or accident. Like when it comes to healing.
absolutely. And ultimately, they circle back. If you continue to have pain and loss of function, get with the doctor. And it even helps you with recurrence. And as you can see, we've covered this whole darn book and been able to talk about it for a little over an hour. But I love this series, and I think it's important for me. I'm not trying to be competitive or put other coaches down. I just want to be the best coach I can be, and I just love trying to get better as a coach, trying to be able to be a better asset. And I think this series of books from McKenzie is a way that uh, I don't think it should just be like two separate fields where you just go from rehab to fitness, right? I think they segue into each other, and both the rehab pros and the movement pros should know enough about each other's fields that they can work together, that they can, like a movement professional, can know when to refer to a doctor. And the doctors I have an appreciation for the power of exercise, for the power of these four pieces of health that you talk about, because unfortunately, it probably happens too much where you have doctors that don't care about exercise, and whether in word or deed, and often in deed they don't exercise. And my recommendation is, if you're trying to if your shoulder, your health, your joints are important to you, do a little bit of research into the rehabilitative professional that you work with. If that's something basic, they should exercise themselves. They should be advocates of it, encourage it. If they don't, or they're not, I would maybe find somebody else.
Yeah, absolutely. Definitely someone who tries to encourage movement and the rest of the pillars of health, not necessarily medicines and passive modalities. This book is really incredible, even for the advanced athlete. Because um, they might not be able to do these simple movements like reach behind their back well. Of course, if they can do all of these things very easily and effectively, then it's time to progress them, which, me as the physical therapist or the athletic trainer gets to have a lot more fun with them. But, like if they can't do this, then, like what might be the root cause of their problems. Like, why move on to anything else if they haven't shown their ability to reach behind their back and to demonstrate release and comfort in a pendulum or anything of the such?
And that's a good point. Is this book could also probably save athletes a lot of heartache, because you don't want to wait until you're hurt. If you can understand the concept that these stresses, yes, you can have an acute injury, but these overuse injuries or persistent injuries, that they're a process, not an event. So if you're stretching as you go, knowing to have some diversity in your movement, resting enough, you you can probably add years to your career, or to add to the enjoyment and quality of what you do. You might not be able to control this completely, because some coaches drive the athletes too hard often, and it, rest can be looked badly upon, but the hopefully both the athletes and the coaches can, this is a book that could educate them, but hopefully you can get buy-in from athletes and coaches that if you rest enough and heed some of these warnings, it's gonna just like the contractor who you're trying to help by saying, hey, if you do these things, you can work better and longer in the long term. Athletes, there's a part of education as well, is okay, if you do things smart, you're going to have a longer, more enjoyable athletic career. But it can be tough because there's also sporting culture where it's like more is better, which only applies to money. That's an economic principle. It's not an exercise principle. I didn't invent that. But yes, this could also be hopefully an athlete doesn't have to wait until they're severely injured to start heeding some of this information.
Yeah, it's hard to name like a pitcher or a swimmer who hasn't had shoulder pain, you know? Um,
Oh, and
so being able to open them up to different things to work in as opposed to work out, in the name of whatever his name is, I believe, Czech, uh, like to feel better and to grow and be the best you could be.
yeah, and so for example, like in martial arts, like your jujitsu, you love jujitsu, and I've thought about this in terms of wrestling practices. Jujitsu, MMA is incorporating more breaks, something where you can stay warm. You don't want to cool off, but something where during the practice you incorporate some more breaks to allow some of these connective tissues to recoup, or even incorporating some of these stretches as breaks throughout the practice so that you're not accumulating all that abuse for 2 hours. And also, of course, just take plain old taking days off. I would say if you're a serious martial artist, whether it be jujitsu or doing scholastic wrestling or MMA, which is a whole other story because of the concussive nature, but take 2 days off at least a week. Those connective tissues, I don't have any hard evidence. I don't have like any reference right now to pull up for anybody, but just from experience and my understanding is like, give yourself at least 2 days off. Your body will thank you. They need those tissues, and your nervous system needs that rest.
Yeah, as a martial artist, I've met many, and the best ones that I've met typically train 3 to 4 days per week. And then, like, their sport, whether it's kickboxing or jujitsu or MMA, and then they'll do a fifth day of cross training. They'll play ping pong, they'll play basketball, they'll do like a different sport on that fifth day, and then they do 2 days off.
And that should be, I think that's enough. And if you're disciplined and take care of yourself, you'll be able to practice for longer. But it's amazing how, especially in martial arts or jujitsu or wrestling, uh, people will push the envelope and then have to spend so much time injured. Like they take, like if you don't get injured, you can train more in the long run. Or
Yeah,
if you get as injured severely.
I remember getting injured and taking 2 weeks off and then coming back and then being better than ever. Like, I was more successful with submissions. I was more successful with positions, and it was cool. I was like, oh, maybe I should, prioritize my rest a little bit more.
It's interesting is those, you can come to those conclusions serendipitously, I'll put it that way, or also keep a training journal. See, you can just gauge, okay, how did you perform after a rest day? How did you perform after 2 days of rest? What happened after 3 weeks? Did you start seeing your performance start to drop off? At what point? Something, and this is where a trainer can be useful, help get that perspective. is yeah, keeping a log, some sort of data as you go. I mean, you could keep data also on pain, like, and I don't believe the McKenzie book uh, discusses this, but I think Stuart McGill does a good job of this in the book Back Mechanic for his take on low back pain, which I also would recommend. It takes more time to read, but I'm big on journaling, logging, keeping some data on what's going on, and also, I mean, that of course that only is going to help me help people as a professional, but even just for myself, uh, I like to keep that information and look back on it.
When I was journaling for jujitsu, that's when I saw the most progress. I had a jujitsu journal and I'd write about what I learned that week,
That's
and
awesome.
I'd get creative and stuff. I didn't necessarily like document repetitions or dosage or like how many hours I was training. It was more so philosophically, like what technique did I learn? How did I feel doing it? Were there other techniques that I think could relate to that one, etc.? But it was still like a journaling process that helped me.
Yeah, that's awesome. And I do. Well, we will have to bring this talk to a close. It was awesome. We went through the whole book. There'll be more for the audience out there. There'll be more for you. This isn't the end, but I think this is a great start, and a lot of gems in here from Danny. And we'll keep you posted on future conversations and future info we have coming your way.
Yeah, and keep a lookout for the manuscripts.